I had a stroke, and it was an evening, it was about 6:30 or so, and my wife noticed that I was walking kind of funny, and she said, "Dick, we better go to the emergency department." They gave me a super clot buster, and it was amazing because it has a 3-hour window of opportunity. And because of my wife, we got there in that 3-hour window. I would say that I was truly amazed that I could have a stroke and be out of the hospital in 3 days and playing golf that quickly. That kind of care is like a story. It's like magic.
For every patient who discovered that superior healthcare means more than fancy technology and proficient medical experts. For every senior living resident who found a trusted friend and impeccable healthcare at the same doorstep. For every landmark research project that changed medicine to improve lives. You were there. For every hour you give back. For every dollar you share. For every life you touch. You are here. It's hard to find the words sometimes, but the impact is unquestionable. That's why it's simply not enough to provide superior health care. Making a difference is what matters.
I'm very fortunate in that I have over 1,500 community volunteers in this hospital that I see on a day-to-day basis. They make this hospital. The medical staff, the volunteers, that's what makes a hospital. It's not about bricks and mortar, it's about people.
It is very, very rewarding. You will meet fantastic people. It actually will be a gift to yourself, and you will receive far more than you give.
That exceptional patient care experience is possible thanks to generous donations from Sun Health community partners and donors.
We've been able to do a number of things with philanthropic support, and the biggest and most obvious is our D Tower, our brand new tower that opened in February of 2009. That was made possible by a $20 million grant from the Sun Health Foundation, and without that money it wouldn't be the level or as nice as it is today.
Most recently, we were able to upgrade our digital mammography over at the Lakes Imaging Center. We were able to purchase a neuromicroscope to do advanced neurosurgery for our community. Those things would not be possible without the support of this community.
Banner Health, the Sun Health team, and a community that cares work together. The result is nationally recognized healthcare, dedicated philanthropy, and a mission that transcends generations.
I can't really think of a higher calling than something like this. I know that a lot of people want to leave major money to family and to churches, but the hospital should be right up there too, because it's saving lives, it's enriching lives.
These two hospitals and the Research Institute would not be here if it were not for the community and their generous support, giving of their time, giving of their talent, giving of their treasure has made it possible to offer world-class health care in the West Valley.
Our commitment includes care and service outside hospital walls as well. This includes the more than 700 residents who call Sun Health Life Care Communities home.
You know, Sun Health is really focused on healthy living. It's focused on you as that individual and how do you maximize, you know, your living in the environment that you choose to live in. You know, our senior living communities are really tailored to bring the best of all of those resources together so that you can live that high quality of life for as long as possible in a very nice resort type setting, but still giving you that freedom of independence and control.
Being a resident of First Grandview and now La Loma has just given me a great feeling of security, and I'm still very active, but I love living in a residence that you know they will take care of you. We're pampered and just nice people to be around.
In addition to local programs and services, your commitment to superior healthcare reaches far beyond local boundaries. This includes internationally recognized research, such as a landmark cardiac study, funded through a $2 million grant from the Sun Health Foundation.
For the last 20 years or so, I've been focused on finding a treatment for a disease that typically hit older population like our population here in Sun City, and that is congestive heart failure. And unfortunately, there is no treatment available for that disease. Therefore, I devoted my life and my lab to come up with a treatment for that. So what the foundation and the community of Sun City provide us with the fund to try to translate that research from the basic science, from the bench, to hopefully to a patient care. I mean, for me, success is if I can actually help one person, one patient in Sun City community get out of their bed and walk and become productive again.
Your faithful giving has raised more than $300 million for multi-hospital expansions, internationally recognized research, and the area's best healthcare, period. Because of you, Sun Health is stronger than ever.
Many organizations are successful. What we're seeking at Sun Health is to take our organization from success to significance. What that means is we not only want to achieve at a certain level, we want to make sure that what we achieve has a long-lasting giving back effect to the community. And that's really our focus in creating new different programs that then can be picked up and utilized by the community and by other organizations that we're in partnership with.
For today, for tomorrow, for more than 40 years, you've kept your promise. We'll keep ours.